Thank you. And the second questions really are around mental health, but in particular children's mental health. I'm conscious that for many years there's been a challenge around support and ability for children to get mental health support through the NHS and wider. I know there's been an awful lot of work done on that. Claire Murdoch has given excellent evidence to this committee. But looking forward, we're going to have mental health challenges for children who've been in lockdown and their families. What provisions are being put into place for the rise in mental health need, and also to ensure that that provision is as robust and as strong as possible in the coming months and years?
Yeah, absolutely. It's an incredibly important area where, within the increase in funding that the NHS is getting over the next 3 or 4 years, we are the fastest increase within the services in the NHS is in mental health. And within that, children's mental health is getting the fastest increase. So it's not just about the money, but the money, of course, is very important. And at the same time, we need to develop and improve access to services, including where appropriate and where it's best used using digital technology. But that isn't that will help, but it isn't the solution to all of these problems.
And may I also ask, just with regard to mental health provision, obviously at the moment people, if they need physical health support with medicines and so on, they would walk into their local pharmacist. I wondered if it's possible to look at whether pharmacists could also be a front line for mental health with regard to mental health first aid training, with regard to support, to be a sort of a signpost to additional services. Is that something that we could potentially look at, or has been looked at over recent months as times have changed?
Yeah, it's not something that I've looked at specifically. If we can make that work, I'd be open to it. We've put in the focus, especially for paediatric mental health, has been to put support into schools to make sure that they have firstly they have a mental health coordinator who can then make sure that the connections are made between the school and the local children and young persons mental health services. And so we've done it through schools, but I'm always open to ideas. And this ties together two things that are very important to me. One is the importance of having high-quality mental health services that are easy to access. The second is the importance of putting more services through pharmacies who are there in the community, rooted in the community, and readily available. So I want to support pharmacies and I want to support mental health. You brought the two ideas together, but it's the first time anybody's put that idea forward. So I'd want to then go and reflect on it.
Thank you. And just very finally, to any parent who's out there, their children are just going back to school, anxiety may be high. If their child, they feel that their child needs some mental health support, what advice would you give them right now, please?
Well, in the first instance, they should contact their GP, or they should contact one of the widely available and excellent charities that provide mental health services, and in particular, for instance, Mind, the ability to get support. The single most important message from all of us is that there is help, and people should ask for it. And that often is the first and most important step in treatment for mental ill health.
Thank you.